Hi, I'm Helen from the LEEP team, and today we're going to be talking about how to keep your chest clear of phlegm, sputum, spit, secretions, whatever you guys want to call it. But for the benefits of this presentation, I'm going to refer to it as phlegm. So what we're going to be covering today, we're going to be covering why we get the phlegm, why it's important to keep your lungs clear of phlegm, how the body naturally clears this phlegm, and what you can do to help keep your chest clear. So, first of all, why do we get phlegm? Well, it's important to realise that phlegm is actually normal. We naturally produce about 500 mils of phlegm every day, but normally it's managed through natural processes such as swallowing and through your saliva. In some lung conditions, the lungs produce a larger volume of phlegm due to changes in the phlegm-producing cells. Also, changes in the structure of the parts of the lungs due to your condition can make the phlegm much more difficult to manage. So, how do the lungs make and move phlegm? So cells in the airway walls called goblet cells produce the phlegm as part of the defence system of the lung. Adjacent cells, you can see them here next door to the goblet cells, these purple ones, have cilia on the top, which are hair-like projections, and they help move the mucus up towards your mouth, picking up debris as it goes along. So it's part of the natural defence mechanism of the lung. These cilia, those hair-like projections on the cells, act in a Mexican wave to move the mucus or phlegm towards your mouth. So if you imagine, if you're in a football stadium, we've all seen the way that the way that a Mexican wave works in a football stadium. We have one person standing up, and then hopefully the next person stands up, the next person stands up, the next person stands up, etc. So you get a wave-like effect all the way around the football stadium. And that is essentially how your cilia work. They work together to wave the mucus up towards your mouth. However, in some conditions, there is an increase in the number of goblet cells, and in that case, there is an increase in the volume of phlegm that you might produce. For example, in the lung condition COPD, this increase in the number of goblet cells is a response to an irritant such as cigarette smoke. So, also, we might see narrowing of the airways in conditions such as COPD, again, and asthma, making it more difficult to clear the phlegm. So you can see here, we've got on the right-hand side, we've got this normal airway, nice and wide and open. And on the left-hand side, you can see here the narrowing of the airway caused by the lung condition. And you can see the phlegm sitting in the airway and how much more difficult that's going to be for you to clear it. Also, in conditions such as bronchiectasis, we get this widening. So can you see on the picture that we get the widening of the airways, meaning that the phlegm can get stuck in these little pockets, and that means it's much more difficult to move. So that's a little bit about how the lung produces phlegm normally, and a little bit about why, if you have a lung condition, it is more difficult to clear, or you might produce more than the normal individual. But why does the phlegm change colour? So when you have an infection, your body automatically and naturally sends an immune response straight to the site of infection. Now this immune response is full of cells from the immune system, and those cells contain a yellow or greenish coloured enzyme, and that is what changes your phlegm from a nice clear colour to this dark green or yellow colour. And also, lots of the movement of these cells into the mucus makes it a lot thicker and more difficult to clear. So the important thing for you to remember is that you need to keep an eye on it. If you take one thing from this presentation today, it is keep an eye on your phlegm. Some people will only notice phlegm when they have an infection. So on a day-to-day basis, they will not produce any phlegm. And then if they unfortunately pick up a chest infection, they will start to produce the phlegm. Some people will produce phlegm all the time, every day, as part of their condition. So in that case, you need to be aware of when that changes as well. So it's important to know what is normal for you in a day. So for example, you might find that you wake up first thing in the morning, you've got that tickly chesty cough, and most of the time you're able to clear about a tablespoon of maybe yellowish phlegm. But then if that changes, so you wake up in the morning, you feel that chesty cough, you cough up the phlegm and it's dark green, and then you have a little bit more in the afternoon, a little bit more in the evening, that's different. So there's a difference in the colour, in the amount that you're producing, and there probably will be a change in the thickness. And that's what you need to be aware of. So why is it important to keep your lungs clear of phlegm? A build-up of excessive mucus or phlegm can make the lungs much more vulnerable to infection. So if you can imagine, you've got this phlegm stuck in your airways. Now your lungs are a very warm and moist environment, and this is static. So it's going to be a source for infection to breed. So the more we can keep your lungs and airways clear, the less likely you are to attract that infection. Also, as you can obviously see from the picture as well, when you've got phlegm in your airways, it makes them even narrower. And so it's much more difficult for the air to move in and out. So therefore, you may well feel more breathless if your airways are full of phlegm. So that was a little bit about what happens when you might get an infection, and a little bit about why it's important to keep your chest clear of phlegm. Now a little bit about what you can do to help keep your lungs clear of phlegm. And one of the most important and easy things for you all to do is stay hydrated. A dry body makes thick and sticky phlegm. So if you think about those cilia on that first picture, and they were all in that nice mucus layer moving in their Mexican wave. If you don't drink enough and hydrate your body enough, it will take away water from that mucus layer that the cilia operate in, and then it will become much more difficult for those cilia to operate. So a way of thinking about this and imagining this is if you're on the beach. When the tide is in, you might well see seaweed on rocks, and as the waves move in and out, you see the seaweed moving in that wave formation. That's a little bit like cilia when they've got their hydration or water. If you take that away from the cilia, they're going to stop working. So if you imagine when the tide goes out, what's going to happen to that seaweed? It's all going to dry out and get stuck to the rocks. And that's essentially what can happen to your cilia. If you remove the water from it, it potentially gets more sticky for the cilia, and they're unable to move in that nice wave formation and help you move the phlegm. So it's important to try and drink about 6 to 8 glasses of water or other fluids every day, unless your GP tells you to limit your fluid intake. Another thing you can do that can help you keep your chest clear is to exercise, and that's all why we're here today. So moving around and exercising is often the best way to keep your chest clear. When you exercise, you naturally take deeper breaths, and this brings air behind the phlegm and helps move it out of the bottom of your lungs up towards the top and your mouth, ready to clear. So by partaking in your exercise and activity, you're helping to keep your chest clear. Now on to a little bit more technical things. So this cycle here is something that we try and teach all patients who have got a lung condition who produce phlegm. And this is called the active cycle of breathing technique. And some of you, no doubt, will be familiar with it. It is a 3-stage technique and also a cough on top. And you can see from the diagram, you've got a deep breath, something called breathing control, and then a huff. And then after that, we would be having a cough. And what this does is mimics or assists the natural way that the body clears phlegm and can help clear that phlegm up towards your mouth. Now I'm going to do a quick demonstration now of the components of the active cycle of breathing technique, but also attached to this presentation will be a document with all the information on that you can go and refresh after the presentation. So the first part of the cycle is taking a deep breath. Now it's important that when you start that you get yourself into a really good position. Obviously I'm standing up to do this presentation, but you may well want to sit down in a really good supportive chair. And what you're going to do is pop your hands on the top of your chest, a hand on the bottom of your chest towards your tummy, and you're going to take a deep breath in through your nose if possible, and then gently out through your mouth. And the idea is that we should try and see a lot of the movement of your deep breath down near the bottom of your chest, near your tummy. You will get some movement at the top, but most of it should come from the bottom. If you can, we ask that you try and hold that deep breath for 2 to 3 seconds to allow the air to completely get to the bottom of your chest. Now what the deep breath serves to do is to get the air behind the phlegm and move it up towards the centre of your chest. Now we advise that you try and do 3 to 4 deep breaths. Any more than that, you may well start to feel a bit funny or a bit dizzy, so we just try and limit it to that. So the second phase of the cycle is something called breathing control. And this is essentially normal, relaxed breathing. And we may well have talked a little bit about this in previous talks. So again, you're going to pop your hands on your chest and on your tummy at the bottom of your chest, and you're just going to breathe gently through your nose. And what this serves is to just keep your airways nice and calm and to reduce any irritation that we might be causing doing this technique. Now the final phase is something called the huff. Now we like to liken this to doing a little bit to like doing spirometry. Now if you remember, and a lot of you will remember doing spirometry or breathing tests, the person doing the breathing test will ask you to take a very large breath in and then push the air out as hard and fast as you can, and then we would hear the phrase keep going, keep going, keep going, keep going, to try and empty your lungs. That isn't what we're going to ask you to do, but the technique, the forced breath out, is essentially what we need you to do. So for this, I'm going to take a medium-sized breath in, and I'm going to force the air out really quickly with my mouth open. So similar to doing my spirometry or steaming up a mirror or a pair of glasses. And you can see that I've got my mouth nice and open, so I'm not blowing, I'm actually forcing the air out with my mouth open. And what this serves to do is that push that phlegm that little bit higher towards the back of your throat, ready for that cough. Now the important thing about the cough is not to cough until you're ready. So the phlegm must really be there. If it's not there and you feel that cough coming on, go back to the quiet, relaxed breathing to try and suppress that cough and rest the airways. Now I've just demonstrated very basically the 3 components. This is a very individual technique and everybody will know what works for them. For some people, they might just need to take 1 or 2 big breaths and they can really feel the phlegm is on the move. 1 huff, cough, and it's out. But for some people, they need to work a little bit harder. So my advice to you all is to go away, have a go at the components and work out what works best for you and the best way of putting it together to move your phlegm along. Important things to remember is to try and stay hydrated throughout the technique. So keep that glass of water nearby and make sure you're drinking plenty as you go along. And that will just keep that phlegm nicely on the move. So I've spoken to you about the breathing techniques. The other things you can add in to help the phlegm a little bit more is gravity. Now you can see from the pictures here that we've got some people lying on the couch and they've got their head tipped down to allow gravity to help move the phlegm along. There are also various positions that help various parts of the lung, and some of you might already use some of this in your chest clearance regimes. What I would say is that not a lot of people tolerate this head down position, especially if you have reflux, because it encourages the acid up and that's not very good for your chest. The other thing is it can make you feel particularly breathless. So that might be something that works for some people, but not for others. So here we have a collection of something called adjuncts. So these are things that we add in to the breathing exercises, maybe to the gravity positions to help us even further. The flutter and the a cappella are what we call oscillating or vibratory devices, and their role is to provide a vibrational force to help keep that phlegm moving along. The difference between the two is that the a cappella can be used in any position, so you can use it whilst lying head down, whereas the flutter you can only use in an upright position. There are some people that cannot use these devices, so therefore we advise that you are assessed by a physiotherapist before commencing using these devices. The other picture we've got here is that of percussion. I imagine that some of you have seen this in various texts or on the screen or part of the course, and it's where we have a therapist or a carer or a relative providing a clapping or cupping technique to parts of your lung. Again, this is a technique that should be taught by a physiotherapist, but it's something you can do yourself and also can be done by a member of your family or your carer. Finally, a little word about medications. The main medication that can help with your phlegm is something called carbamazepine, and some of you might recognise that name. It's what we call a mucolytic, so it acts directly on the phlegm, breaking it down and making it easier to use. The normal dose of carbamazepine is 750 milligrams 3 times a day for the first 6 weeks. So that's 2 large capsules 3 times a day for 6 weeks, although it does come as a syrup if you struggle with capsules. And then at that 6-week point, we're able to reduce the dose to a long-term dose of 2 capsules twice a day. Now the thing about carbamazepine is it either works or it doesn't work, and we're not sure why. So that's why we go for that 6-week trial, and if at the end of that 6 weeks it's not having any effect or helping you at all with your phlegm, we'll stop it at that point. But if it's helping you and you're finding it beneficial, you can continue on that maintenance dose moving forward. Now, your inhalers. Now, a lot of you will be taking or have a blue reliever inhaler, sometimes called Ventolin or salbutamol, or in some cases Bricanol. And this can potentially help you open up your airways even further and therefore allow the phlegm to travel better through your airways. So if you're prescribed that inhaler, it can help you to take that before you start clearing your chest to make sure that your airways are optimally open. The other factor with Ventolin or salbutamol is it can potentially assist with the cilia, those hair-like projections in their movement. So it may be useful for you to take that before clearing your chest. The other important thing is to make sure that you take all your other inhaled medication, because these all help to keep those airways open and the phlegm to travel well. A quick word about nebulizers. If you use a nebulizer for your Ventolin, again, it might be useful to take that before you clear your chest to open those airways. But for those people who use nebulized antibiotics, it is important to take those after clearing your chest, because then the antibiotic will travel better into your lungs because they're a lot clearer. If you take hypertonic saline, it's important to take that before you start your chest clearance, because we know that that helps in some cases to thin down the phlegm and make it easier to clear. So when should I be looking to clear my chest? Morning is a good time to sit down and make your chest nice and clear. You've been lying down sedentary for a long period of time, and the phlegm can build up in your lungs. And hopefully clearing that all out at the start of your day will mean that you have a better day. Evening is also a good time to clear your chest. That just makes sure that it's nice and clear, and hopefully you'll be able to get a better night's sleep if you're not so troubled with the phlegm. However, if you have a chest infection and that volume of phlegm starts to go up, you should try and routinely clear your chest more regularly. And as I've said before, try and use your reliever, inhaler or nebulizer, that's nebulized Ventolin or salbutamol, about 10 to 15 minutes before you start. So now we're going to start to recap on what I've covered today. Just a quick summary of what you need to be looking out for. The important thing to look out for is a change in your normal. So as I said to you before, if you take anything away today, go away and think about what is normal for you. How thick your phlegm is, when you produce it and how much, and what colour it is. So therefore, if you notice that you have more and the consistency is changing, and you have a change in colour, or it's becoming more difficult to clear, you need to keep an eye on it. Most of the time, if you've got a bit more and it's a bit thicker, you can just keep a little eye on it. However, if you see a significant change in colour, mostly to a khaki or green colour, you probably need to seek advice from your doctor. But we will be going through this in another talk as part of the programme. So remember, phlegm is normal, but in some lung conditions, the changes in your lungs mean that you will produce more, and it might be more difficult to clear. It is really important to keep your chest as clear as possible from phlegm. This is to reduce your chance of infection and to help with your breathlessness. There's a lot that you guys can be doing to help with this process. And so you need to go away, have a think about all the resources, all the techniques that we've talked about, and work out what works for you. It is really important to know what phlegm is normal for you. Then you know when something might be wrong. So that's all I've got to say today. If you do have any questions about the content of this talk today, then please feel free to email us with your comments to the LEEP email inbox, and we'll do our best to get back to you as soon as possible. Thank you very much for listening today.